The proceeding will start shortly. 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 The proceeding will start shortly.
Order Cat-Smith to move the motion. Cat-Smith. you, Dame Maria. And I beg to move that this House has considered E-petition 635904 relating to the International Health Regulations 2005. In March 2021, a group of world leaders, including then UK Prime Minister Boris Johnson, announced an initiative for a new treaty on pandemic preparedness and response. This initiative was taken to the World Health Organization and will be negotiated, drafted and debated by a newly established intergovernmental negotiation body. This is the second time the Petitions Committee has scheduled this issue for debate. In April this year, a petition which called for the government to commit to not signing any international treaty on pandemic prevention and preparedness was established by the WHO unless this is approved through a public referendum, was debated after it reached the threshold of 156,086 signatures. Today's e-petition calls on Parliament to hold a parliamentary vote on whether to reject amendments to the IHR 2005. The Government has responded to this petition, explaining that the UK supports strengthening the IHR and the amendment process. Through meeting with the petitioner, she would like the Government Minister to address the concerns of the petitioners in his response today. Specifically, which amendments, if accepted, would require changes to UK domestic legislation, who is representing the UK, and will this information be publicly available, and what is the Government's position on the amendments and which change language in the regulations from may to shall, and will the UK vote against these changes? What is the UK's position on whether this should be binding or non-binding, and has the UK proposed any amendments? And I hope the Minister will be able to address those issues in his remarks once we get to this stage in the debate. In the March 2021 joint article, the group leaders said, quote, "The main goal of this treaty will be to foster an all-government and all-of-society approach, strengthening national, regional and global capacities and resilience to future pandemics. This includes greatly enhancing international cooperation to improve, for example, alert systems, data sharing, research and local, regional and global production and distribution of medical and public health countermeasures such as vaccines, medicines, diagnostics and personal protective equipment." And given the weekend news coverage of the fallout of some of the challenges faced by the procurement of PPE, it's perhaps timely that we debate this petition today. When the next pandemic happens, I hope any future government will have learnt the lessons from the past. On specific questions of UK sovereignty and amendments relating to restrictive measures, the UK government has explained in its response to the petition that, quote, "We have been clear that the UK will not sign up to any IHR amendments that would compromise the UK's ability to take domestic decisions on national public health measures. There are currently no plans to hold a vote on IHR amendments. Should the UK government wish to accept an IHR amendment, then, depending on the content of the respective IHR amendment, changes to domestic law considered necessary or appropriate to reflect obligations under the IHR amendment may be required. The Government would prepare such draft legislation before Parliament in the usual way. In all circumstances, the sovereignty of the UK Parliament would remain unchanged and the UK would remain in control of any future domestic decisions about national public health measures." Dame Maria, finally, I would like to take this opportunity to thank all our healthcare workers who worked through the pandemic. And as we go into the Christmas period, many of them will be working whilst we're enjoying those turkey dinners with our families. So I pay tribute to their commitment and to all the others that are working in our healthcare systems. The pandemic affected us all differently, and I hope in this season of goodwill, we are mindful of all those who are more vulnerable than ourselves. And with that, and on behalf of the Petitions Committee, I thank all members of the public who have engaged with e-petitions, including this one, in 2023, and I look forward to hearing the well-informed contributions of honourable members today. Thank you.
Thank you. Before I call the first speaker, can I just remind members that if they wish to contribute, they should bob. And I can also remind those who are sitting in the public gallery that there should be no applause and no photographs at any time. Thank you. Philip Davis.
Thank you very much. It's a pleasure, as always, to serve under your chairmanship, Dame Maria. I'm really grateful to the Honourable Member for Lancaster and Fleetwood for moving the motion and also for agreeing to the debate in her role chairing the Petitions Committee. It's very much appreciated. I'd also like to thank the 116,391 people who signed this petition, including 189 of my Shipley constituents, which helped to secure this important debate today. Now, in preparing for today's debate, and the Honourable Member mentioned this in her opening remarks, I look back at the contributions heard in April when another petition on this topic was debated here in Westminster Hall. I have to say I was disappointed by some of the rhetoric there when valid concerns were dismissed as an overreaction and hysteria. It's clear that, that this is, quite rightly in my opinion, an important issue for the public, and we can see that that's the case, not just from the full gallery today, but also the large numbers signing these petitions. So what are we dealing with here? We have two international legal instruments, both designed to increase the WHO's authority in managing health emergencies. The first concerns the amendments to the existing 2005 International Health Regulations, the IHR, and the second is the World Health Organization's new pandemic treaty, which would support the bureaucracy and financing of the expanded IHR. Both of these instruments are designed to transfer decision-making powers to the World Health Organization, with the admirable aim, no doubt, of improving how the world prevents and better prepares for disease outbreaks. But in practice, what is being proposed could have a huge and detrimental impact on all parts of society and also on our sovereignty. If the IHR amendments go through, then countries will have undertaken to follow recommendations, not merely consider them, with the proposal to remove the words non-binding from Article 1. While in Article 42, the regulations are to be initiated and completed without delay by member states. Therefore, we can only assume that the intention behind these amendments is for them to be binding under international law. Now, I don't wish to over-egg the nature of these proposals, but I can't help but be concerned by the thought of removing the words non-binding. There is much that would suspend fundamental human and bioethical rights in the existing IHR, such as requirements for vaccinations, medical examinations, and implementing quarantine or other health measures for suspect persons. In other words, mandates and lockdowns. It's all there in black and white under Article 18. I think we may have become only too mindful of the harms of lockdowns, and I'm sure members will be aware of the latest findings published by the Centre for Social Justice about the harms caused by lockdowns, not to mention the non-existent science used to enforce wearing a face mask, which the COVID inquiry has also uncovered the fact that that was based on absolutely no science whatsoever. Going back to the debate in April, we were told by the then Minister that this is simply not the case, that the instrument will undermine UK sovereignty and give the World Health Organization powers over national public health measures. I really think it's worth revisiting this because I'm really not clear how national and parliamentary sovereignty can be upheld if these proposals are agreed. I would draw attention to the draft new Article 13A, which calls for member states to undertake to follow World Health Organization recommendations and recognise the World Health Organization not as an organisation under the control of countries, but rather as the coordinating authority of international public health response during public health emergency of international concern. Of course I'll give way.
Does my honourable friend share my concern about the lack of accountability? We're having a very extensive and very public examination of the response of the government here to COVID, but there is no comparable examination of the very important decisions and advice that the WHO offered to the whole world and probably had more influence.
Well, my right honourable friend is, as ever, absolutely right, and we should all be concerned. We should all be concerned about that, and we should be concerned that we don't end up fall into the same problems as we've had in the past and being in a position where there's nothing we can do about it. We're sleepwalking into a disaster. We're talking about a top-down approach to global public health, hardwired into international law. And at the top of this top-down approach, you have our single source of truth for all things pandemic, the World Health Organization's Director General, who it appears will have the sole authority to decide when and where these regulations would be deployed. And let's not forget, of course, that the Director-General is appointed by an opaque, non-democratic process, and I think that's being rather generous about the process in which the Director-General is appointed. Rather worryingly, in the response to this petition, the government has said that they are supporting the process of agreeing targeted amendments of the IHR as a means of strengthening preparedness for and response to future health emergencies, including through increasing compliance and implementation of the IHR. They've also previously said that they support a new international legally binding instrument. It certainly sounds like a threat to parliamentary sovereignty to me, and I would like the Minister to commit today to laying these plans before Parliament so they can be properly debated and, if I had my way, robustly rejected. I think it's also vital to take a step back and understand what's driving this pandemic preparedness agenda. At a recent meeting of the APPG on pandemic response and recovery, Dr. David Bell gave a briefing on how the World Health Organization, with the backing of the World Bank, say these amendments are the only way to prepare for future pandemics, which it says are getting more frequent and there's more risk from zoonotic or animal-to-human spread. But the reality is their figures don't tell the whole story. When you actually take into account population growth, significant natural pandemics are rare events. You also have to take into account the fact that there's been a huge expansion of tests and genome sequencing over the last few decades. The invention of PCR testing, for example, has had a massive impact on the detection rate of these outbreaks, the World Health Organization are now using to justify their agenda. Since the Spanish flu over 100 years ago, we've only had 2 pandemics above the average yearly seasonal influenza mortality rates. This is thanks to antibiotics and advances in modern medical care. We seem to hear a lot about disease outbreaks which actually have low mortality burdens when compared to other public health threats. As an example, SARS-1 in 2003 had the equivalent disease burden of about 5 hours of tuberculosis. Funnily enough, the World Health Organization themselves could find no evidence either that serious zoonotic pandemics were increasing in their 2019 pandemic influenza recommendations. What is undoubtedly increasing is the eye-watering cost of managing pandemics, with vast sums of taxpayer money being wasted on poorly conceived initiatives such as locking down the economy for 2 years. It seems to me that the World Health Organization has no need to rush any of this. We have time to reassess and get it right. And it seems I'm not the only one to think this. We've seen in recent weeks signs that some countries, including Estonia, Slovakia and New Zealand, are looking to question the proposals. It's not clear if any member states have submitted formal notices to reject and opt out, but New Zealand does appear to have lodged a reservation to allow the incoming government more time to consider whether the amendments are consistent with a national interest test required by New Zealand law. This is entirely sensible, and I would like to see our own government take a pause to apply some critical thinking to this situation before blindly supporting the World Health Organization's installation as our new global public health power. It's absolutely essential, Dame Maria, that the government makes a clear and unambiguous promise that it will neither support nor abide by anything which in any way undermines our national sovereignty. We have not spent so many years battling to get out of the frying pan of the EU to jump straight back into the fire with the equally unaccountable and undemocratic and hopeless World Health Organization.
Andrew Bridgen.
Thank you, Dame Maria. It's a pleasure to serve under your chairmanship. I too would like to thank the 116,000 members of the public who signed this public petition so that we can have this important debate today. And I'd also like to thank Dr. David Bell, someone who actually has worked for a long number of years for the WHO, for his briefings to me, and also to the Swiss lawyer, Philip Crusay, for his contributions to my information today. And I would like to start by agreeing with the Honourable Member for Shipley, who we both spoke in the public petition debate on the 17th of April earlier this year, where we considered the pandemic treaty. It is impossible to consider either the pandemic treaty or the amendments to the international health regulations in isolation. They are two linked instruments of the WHO, and they need to be considered in parallel. And my opening question, is why does the WHO make false claims regarding proposals to seize states' sovereignty? Dame Maria, the Director General of the WHO has stated that no country will cede sovereignty to the WHO, referring to the WHO's new pandemic agreement and the proposed amendments to the international health regulations currently being negotiated. His statements are clear and unequivocal, and also wholly inconsistent with the text he's referring to. And I would remind the Chamber that this is the unelected, unaccountable, non-tax-paying, immune from prosecution due to diplomatic immunity Director General of the WHO, and that all employees of the United Nations and the WHO enjoy these particular perks. Any rational examination of the text in question show that the documents propose a transfer of decision-making power to the WHO regarding basic aspects of societal function which countries undertake to enact. The WHO Director General will have the sole authority to decide when and where they're applied, and the proposals are intended to be binding under international law. Continued claims that sovereignty is not lost, echoed by politicians in this House and other elected assemblies, and of course the media, therefore raise very important questions concerning motivations, competence and indeed ethics. The intent of the text is a transfer of decision-making currently vested in nations and individuals to the WHO, when its Director General decides that there is a threat of a significant disease outbreak or other health emergency likely to cross multiple national borders. It is very unusual for nations to undertake to follow external entities regarding the basic rights and healthcare of their citizens, more so when this has a major economic and geopolitical implication. The question of whether sovereignty is indeed being transferred and the legal status of such an agreement is therefore of vital importance, particularly to legislators of democratic states such as ourselves. We have an absolute duty to be sure of our ground, and I systematically examine that ground here today. So amending the 2005 International Health Regulations may be a straightforward way to quickly deploy and enforce what appears to be the new normal for health control measures that we've seen implemented since COVID-19 pandemic. The current text applies to virtually the entire global population, counting 196 states, including all 194 WHO member states. Approval may or may not be required by a formal vote of the World Health Assembly, as the recent 2022 amendment was adopted through consensus. If the same approval mechanism is to be used in May 2024, many countries, and indeed the public, may remain unaware of the broad scope of the new text and its implications to national and individual sovereignty. This is why today's debate is so important. The IHR sets recommendations under a treaty process that has force currently under international law. They seek to provide the WHO with some moral authority to coordinate and lead responses when an international health emergency, such as a pandemic, occurs. Currently, most are non-binding, and these contain very specific examples of measures that the WHO can currently recommend, including in Article 18. They can require medical examinations, they can review proof of vaccination or other prophylaxis, require vaccination or other prophylaxis, place suspect persons under public health observation, implement quarantine or other health measures for suspect persons, implement isolation and treatment where necessary of affected persons, implement tracing of contacts of suspected or affected persons, refuse entry of suspect or affected persons, refuse entry of unaffected persons to affected areas, and implement exit screening and or restrictions on persons from affected areas. These measures, when implemented together, are generally referred to, since 2020, as lockdowns and mandates. Lockdown was previously a term reserved for people incarcerated as criminals, and it removes basic universally accepted human rights such as measures that were previously considered by the WHO themselves to be detrimental to public health. However, since 2020, it has become the default standard for public health authorities to manage epidemics, despite its contradictions to multiple stipulations of the Universal Declaration of Human Rights, the UDHR. And I will remind the Chamber of the Universal Declaration of Human Rights. Everyone is entitled to all the rights and freedoms set forth in this declaration without distinction of any kind, including no arbitrary detention under Article 9. No one should be subjected to arbitrary interference with his or her private family, home or correspondence, protected under Article 12. Everyone has the right to freedom of movement and residence within the borders of each state, and everyone has the right to leave any country, including his own, and to return to his country under Article 13. Everyone has the right to freedom of opinion and expression. This right includes freedom to hold opinions without interference and to seek, receive and impart information and ideas through any media, regardless of frontiers, under Article 19. Everyone has the right to freedom of peaceful assembly and association, under Article 20. The will of the people shall be the basis of authority of government, Article 21. Everyone has the right to work, Article 23. Everyone has the right to education, Article 26. Everyone is entitled to a social and international order in which the rights and freedoms set forth in this declaration can be fully realised, Article 28. Nothing in this declaration may be interpreted as implying any state, group or person any right to engage in any activity or to perform any act aimed at the destruction of any of the rights and freedoms set forth herein in Article 30. Under these UDHR stipulations, they are the basis of the modern concept of individual sovereignty and the relationship between the authorities and their populations, considered the highest codification of the rights and freedoms of individuals in the 20th century. Dame Maria, they may soon be dismantled behind closed doors in a meeting room in Geneva. The proposed amendments will change the recommendations and the current documentation required through these three mechanisms, removing the term non-binding, as we've already heard from the Honourable Member for Shipley in Article 1, inserting the phrase, the Member States will undertake to follow WHO recommendations and recognise WHO not as an organisation under the control of countries, but as the coordinating authority under new Article 13A. States parties recognise WHO as the guidance and coordinating authority of international public health response during the public health emergencies of international concern and undertake to follow WHO recommendations in their international public health response. As Article 18 makes clear above, these include multiple actions directly restricting individual liberty. If the transfer of decision-making power, sovereignty, is not intended here, then the current status of the IHR as recommendations could remain, and countries would not be undertaking to follow the WHO's recommendations. State parties undertake to enact what previously were merely recommendations without delay, including requirements of WHO regarding non-state entities under their jurisdiction in Article 42. Health measures taken pursuant to these regulations, including the recommendations made under Articles 15 and 16, shall be initiated and completed without delay by all state parties and applied in a transparent, equitable and non-discriminatory manner. State parties shall also take measures to ensure non-state actors operating within their respective territories comply with such measures. Non-state actors, that's private businesses, that's charities, that's individuals. In other words, everyone and everything comes under the control of the WHO once the Director General declares a public health emergency of international concern. Articles 15 and 16 mentioned here allow the WHO to require a state to provide resources, health products, technologies and know-how, and to allow the WHO to deploy personnel into the country, i.e. they'll have control over entry across national borders for whoever they choose. They also repeat the requirement for the country to require the implementation of medical countermeasures, e.g. testing, vaccines, quarantine, on their population where the WHO demands it. Of note, the proposed Article 1 amendment removing the non-binding is actually redundant if new Article 13A and or the changes to Article 42 remain in place. This can and likely will be removed in the final text, giving the appearance of a compromise without actually changing the thrust of the transfer of the sovereignty because of the two other clauses. All of the public health measures in Article 18 and additional ones such as limiting freedom of speech to reduce public exposure to alternative viewpoints, Annex 1, new Article 5E, counter misinformation and disinformation, clash directly with the UDHR, although freedom of speech is currently exclusively for national authorities to decide, and its restriction is genuinely seen as negative and abusive. United Nations institutions, including the WHO, have been advocating for censoring unofficial views in order to protect the people from what they call information integrity. No doubt, Dame Maria, if these amendments were in place, I would probably not be allowed to give this speech today, and if I was, it would never be allowed to be reported in the mainstream media or even on social media. So it seems outrageous from a human rights perspective that the amendments will enable the WHO to dictate to countries to require individual medical examinations and vaccinations whenever it declares a pandemic, while the Nuremberg Code and the Declaration of Helsinki refer specifically to human experimentation, e.g. clinical trials and vaccines, and the Universal Declaration on Bioethics and Human Rights also to provide a patient relationship. They can reasonably be extended to public health measures that impose restrictions or changes to human behaviour, and specifically to any measures requiring injection, medication or medical examination which involve a direct provider-person interaction. If vaccines or drugs are still under trial and not fully tested, then the issue of being subject to an experiment is also real. There's a very clear intent to employ the CEPI 100-day, that's the Coalition for Epidemic Preparedness and Innovation's 100-day vaccine programme, which by definition cannot complete meaningful safety and efficacy trials within the time span. As we know from the COVID-19 vaccines, they're still experimental, years on from their first introduction, because they're still under emergency use authorisation. So forced examination or medication outside of a situation where the recipient is clearly not mentally competent to comply or reject when provided with the information is unethical, requiring compliance in order to assess what are considered basic human rights under the UDHR would constitute coercion. If this does not fit with the WHO's definition of infringement of individual sovereignty on national sovereignty, then the Director General and his supporters need to publicly explain what definition of sovereignty they're using. The proposed pandemic agreement will set humanity in a new era, strangely organised around pandemics, pre-pandemic, pandemic and inter-pandemic times. A new governance structure under WHO auspices will oversee the IHR amendments and related initiatives. It will rely on a new funding requirement, including the WHO's ability to demand additional funding and materials from countries and to run a supply network to support its work in health emergencies. That's under Article 12. In the event of a pandemic, real-time access by WHO to a minimum of 20%, 10% as a donation and 10% at affordable prices to WHO, of the production of safe, efficacious and effective pandemic-related products for distribution based on public health risks and needs, and the understanding that each party that has manufacturing facilities that produce pandemic-related products in its jurisdictions shall take all necessary steps to facilitate the export of such pandemic-related products in accordance with timetables to be agreed between WHO and manufacturers. And in Article 20, in brackets 1, provide support and assistance to other parties upon request to facilitate the containment of spillover at the source. The entire structure will be financed by a new funding stream, separate from current WHO funding, an additional requirement on taxpayers over current national commitments, which is Article 20 in brackets 2. The funding also will include an endowment of voluntary contributions of all relevant sectors that benefit from international work to strengthen pandemic preparation, preparedness and response, and donations from philanthropic organisations. I wonder who they might be. Article 22B, perhaps someone who made a lot of money out of mRNA vaccination. Dame Maria, this is taxation without representation. Currently, countries decide on their level of foreign aid on the basis of national priorities, apart from limited funding that they may have already agreed to allocate to organisations such as the WHO under existing obligations or treaties. The proposed agreement is remarkable, not in just it's greatly increased the amount of countries must give as part of treaty requirements, but in setting up a parallel funding structure disconnected from other disease priorities, quite the opposite of previous ideas on integrated health policy. It also gives power to external groups, not directly accountable, to demand or acquire further resources whenever they deem necessary. In a further encroachment into what is normally within the legal jurisdiction of nation states, the agreement will require countries to establish, under Article 15, no-fault vaccine injury compensation mechanisms, consecrating effective immunity for pharmaceutical companies for harm to citizens resulting from their products that the WHO recommends under an emergency use authorisation. That's going to be embedded. That is going to be the norm, or indeed requires countries to mandate on their citizens. As is becoming increasingly acceptable for those in power, ratifying countries will agree to limit the right of their public to voice opposition to the WHO's measures and claims regarding such an emergency under Article 18, to, as I quote, and combat false, misleading, misinformation or disinformation, including through effective international collaboration and cooperation. As we've seen during COVID-19, the 1919 response, the definition of misleading information can be dependent on political or commercial expediency, including factual information on vaccine efficacy and safety and orthodox immunology that would impair the sale of health commodities. This is why open democracies put such emphasis on defending free speech, Chair, even at the risk of sometimes being misleading. In signing on to this agreement, governments will be agreeing to abrogate that principle regarding their own citizens when instructed to do so by the WHO. The scope of this proposed agreement and the IHR amendments is broader than pandemics, greatly expanding the scope under which a transfer of decision-making powers can be demanded by the WHO. Other environmental threats to health, such as changes in climate, can be declared emergencies at the DG's discretion, in broad definitions of a One Health, if broad definitions of a One Health policy are adopted and recommended. It's difficult to think of another international instrument where such powers over national resources are passed on to an unelected external organisation. It's even more challenging to envisage how this is seen as anything other than a loss of sovereignty. The only justification for this claim would appear to be if the draft agreement is to be signed on the basis of deceit, and that there's no intention for us to treat it in any other way than an irrelevant piece of paper, or something that would only apply to perhaps to less powerful states than the United Kingdom, perhaps a colonialist tool. And I've spoken at length to elected representatives in Africa and urged them to urge their elected assemblies to reject this power grab by the unelected, unaccountable WHO. So both texts are intended to be legally binding. The IHR already has such status. So the impact of the proposed changes on the need for the new acceptance by countries are complicated national jurisdictional issues. There is a current mechanism for rejection of the new amendments. However, unless a high number of countries will actively voice their opposition and rejections, the adoption of the current published version dated February 2023 will likely lead to a future shadowed by the permanent risks of the WHO lockdown and lockstep diktats. The proposed pandemic agreement is also clearly intended to be legally binding. WHO discusses this issue, and it's been supported by the INB and various declarations of the G20. The IHR, as we say, already has standing under international law. While seeking such status, the WHO officials who previously described the proposed agreement as a treaty are now insisting that neither instrument impacts sovereignty. The implication is that states' representatives at the World Health Assembly that will agree the transfer, not the WHO itself, as if that makes any difference to our loss of sovereignty from the UK. The WHO's position raises a real question of whether its leadership is truly ignorant of what's being proposed, or is actively seeking to mislead countries and the public in order to increase the probability of acceptance. The latest version, dated 30th of October 2023, requires 40 ratifications for the future agreement to enter into force after a two-thirds vote in favour within the WHO, the World Health Assembly. Opposition by a considerable number of countries will therefore be needed to derail this project, as it's backed by powerful governments and institutions, financial mechanisms including the International Monetary Fund and the World Bank, and bilateral aids. They're likely to make opposition by lower income countries extremely difficult to sustain. So much of the world, Dame Maria, is looking to our Parliament to step up to the plate and protect democracy around the world. So the relevant question regarding these two WHO instruments should really be not whether sovereignty is threatened, but why any sovereignty would be forfeit by democratic states to an organisation that is significantly funded and bound to obey the dictates of corporations and self-proclaimed philanthropists, and jointly governed by member states, half of which are not even open and transparent democracies. So why would we do this? If it is indeed true that sovereignty is being knowingly forfeited by governments without the knowledge and consent of their peoples, and based on false claims by governments and the WHO, then the implications are extremely serious. It would imply that leaders are working directly against the interest of their people. Most countries do have specific fundamental laws for dealing with this practice, so it's really important for those defending these projects to either explain their definitions of sovereignty and democratic process, or explicitly seek informed public consent. The other question to be asked is why public health authorities and media are repeating the WHO's assurances of the benign nature of the pandemic instruments. It asserts that claims of reduced sovereignty are misinformation or disinformation, which they assert elsewhere are major killers of mankind, while such claims are somewhat ludicrous and appear intended to denigrate the dissenters, such as myself. The WHO is clearly guilty of the very crime of which it accuses others. If its leadership cannot demonstrate how its claims regarding these pandemic instruments they're not deliberately misleading, its leadership should appear ethically compelled to resign from their positions, and we should defund them. The WHO lists three major pandemics in the last century: influenza outbreaks in late 1960s, 50s, 60s, and the COVID-19 pandemic. The first two killed less than die each year from tuberculosis, whilst the reported deaths from COVID-19 never reached the level of cancer or cardiovascular disease and remain almost irrelevant in low-income countries compared to endemic infectious diseases, including tuberculosis, malaria, and HIV/AIDS. Putting the pandemics in perspective, no other non-influenza outbreak recorded by the WHO that fits the definition of a pandemic, e.g. rapid spread across international borders for a limited time with a pathogen not normally causing significant harm, has caused greater mortality in total than a few days of tuberculosis. About 4,000 people a day die from that in the world, or more life years lost than a few days of malaria, which sadly kills 1,500 children under 5 every day. So if indeed it's the case that our government and our opposition parties and their supporters within the public health community consider that the powers currently vested within national jurisdictions should be given over to external bodies on the basis of this level of recorded harm, then it would be best that we have a public conversation as to whether this is sufficient basis for abandoning democratic ideals in favour of a more fascist and authoritarian approach. We are, after all, talking about restricting basic human rights essential for any democracy to function. Thank you.
John Redwood.
Thank you. I hope the Minister will listen very carefully to this debate and the petitioners, because I do think it would be a grave error for the government to sign a treaty which gives away important powers over the future conduct of health policy. It is wrong to give to the WHO the sole power to decide when there is an emergency, and it is wrong to give away our powers of self-decision were such an emergency to be visited upon us. We are, of course, members of the WHO, and I think we're all suggesting we continue to be members of the WHO, and we should share our information, we should draw on their research, they will draw on our research and our knowledge from this country, where there is much medical expertise and pharmaceutical company expertise, and together as collaborators we may get to better answers in the future. But it would be quite wrong to vest the power of decision in people so far away from our own country and not in full knowledge of the local circumstances. And I do think before any such power was to be vested in the WHO, there should be a proper inquiry and debate about how they performed over the course of the most recent COVID pandemic. I mean, why, for example, did they seemingly concentrate on vaccines rather than other methods of handling the problem? Why was there a certain delay or difficulty in testing existing drugs that were already past proper safety procedures that might have beneficial or easing effects on those who got the condition? Why was there not more work on ultraviolet use behind the scenes in airflow systems to clean up the air when it was circulating? Why wasn't there more consideration of isolation hospital and isolation health centres? Unfortunately, quite a lot of the disease was spread through health areas, so that other health matters could be continued during the course of COVID treatment without so much cross-contamination within general hospitals. Why wasn't there recommendation and advice on isolation? Why wasn't there more careful consideration of whether it would be better to concentrate on making sure that those who were most vulnerable were protected from the presence of the disease as much as could be possible, rather than trying to lock down whole populations and then having to make exemptions so that we could keep the lights on and so that some food could be delivered to people's homes, because there was something rather arbitrary about who was allowed to go to work and who wasn't allowed to go to work. Why wasn't more work done by the WHO on cleaning up the data? Because we were given comparisons between countries, but if you look beneath the data, you discovered that they were using very different definitions of what a COVID death was, and there were often very great difficulties in individual countries under the impact of the wave of the disease in actually carrying out proper diagnosis of whether someone really did have COVID or whether there were other medical problems that the person was suffering from that was more likely to have caused the disease. Some countries took a very tough line, saying anybody with COVID died with COVID, although they had lots of other conditions. And so they had big figures, and other countries took a rather narrow view and said, well, this person was in their mid-80s, they were suffering from a number of other conditions which might have led to the difficulty.
Share my concerns that the WHO refused to even have any review of the recommendations they gave out during the COVID-19 pandemic. So sure are they that their advice and the recommendations were absolutely perfect, and that can only mean that if we sign up to these instruments, we're going to get more of the same.
Well, that is one of my worries. I do think we need more transparency, more debate, more discussion and more challenge of those in these well-paid positions at the WHO. So that science can advance, because as I understand scientific method, it isn't choosing a limited number of scientists and believing everything they say. It is having a population of talented and able scientists who challenge each other, because then you get more truth out of the challenge and exchange of ideas. You don't want an international body saying there's only one way to look at this problem or to think about it. You do need that process of challenge, and you need it to be an accelerated process, a challenge when you have an urgent and immediate need of better medicines, better vaccines, better procedures, better approaches to lockdown or non-lockdown. And surely that is the time for healthy debate, constant review, and sufficient humility by all of us who venture opinions on this, because time and the events could disprove them very quickly. And if they do, then you should learn from that process and be honest about it, rather than saying, you were right all along and there was only one way of approaching it. So that's all I wish to say, really, that I think we need much more accountability, much more exposure, much more proper debate, that by all means the WHO can make an important contribution, and it can be a forum for scientists and pharmaceutical companies and others who will be part of the solution should we get some future wave of infection. But please, government, don't trust them with everything. Don't mean that future ministers are not able to act responsibly and well in response to public opinion and to medical opinion within our own country. Do not sell us short, because that would also sell the world short, because this country has a lot to offer in these fields, and it would be best if it allows open debate, proper review and serious challenge.
Thank you very much, Dame Maria, and it's a pleasure to serve under your chairmanship this afternoon. Can I begin by declaring an interest? My wife, Olivia, works as a senior radiographer in the National Health Service. Throughout the pandemic, she continued to report for duty at her hospital, including on occasions knowingly treating patients who were COVID positive. I married a good and brave woman, Dame Maria, and I'd like, and she doesn't know I'm about to say this, I'd like to pay tribute to her this afternoon and to all of her colleagues in the National Health Service who put their lives on the line to save those of many others. They deserve our admiration and our thanks from their Parliament. I've received quite a few emails from my own constituents on this issue. I've also had strong personal representations from Councillor Ian Ward, who ably represents the Lodge Ward on Rochford District Council, who feels very strongly, take my word for it, Dame Maria, about all of this, and has made his views very clear to me as his MP. For the record, I'm all for better sharing of information and intelligence between nations to try and prevent the spread of any future pandemic. Would that the Chinese had done more quickly to warn the rest of the world what was coming from Wuhan. I reluctantly accepted the need for an initial lockdown, but as time wore on, I confess I became increasingly uneasy at the effects of the lockdown, not just economically, but socially, not least in terms of people's mental health. And we're still seeing some of those effects playing out, I believe, in our schools today. That is what my head teachers tell me when I visit their schools. But I'm now concerned about the potential amendments to the international health regulations, the IHR, in future, being brought about at the behest of the World Health Organization, the WHO. That is not least because they will be given extremely strong powers in any future pandemic. As one constituent put it to me in their email, and I quote, "Almost no one who was informed believes the WHO performed anything other than appallingly during COVID with disastrous results. Yet there seems no attempt to reform this unelected, unaccountable organisation which British taxpayers fund in the millions. On the contrary, the drive is evident to give the totally undemocratic WHO ever more power, ever more of our money, and ever less scrutiny." That was her opinion, but I think she has a point. I understand, Dame Maria, that on the 31st of May 2022, the delegates of the WHO formally adopted 5 new amendments to the International Health Regulations 2005. I further understand that these amendments come into force under international law for all member states within 24 months, i.e. the 31st of May 2024, unless those member states choose proactively to opt out of them. Of the 5 new amendments, there's one which is particularly concerning that would severely compromise the ability of the public to lobby politicians to reject future amendments by reducing the time available under which they might come into force. This is an amendment to Article 59, which significantly reduces the time allowed for a country's leadership to reject an IHR amendment adopted at future World Health Assemblies from 18 months to 10 months. Moreover, there are around 300... forgive me, but the honourable gentleman spoke at some length, and perhaps he'd let some of the rest of us have a go. Amendments to the international health regulations are currently being negotiated and finalised, up to 300 of them, to be voted on in May 2024 at the 77th World Health Assembly. Among those amendments being negotiated, I understand are 1. Amendments to make WHO emergency guidance legally binding. Currently, they're only advisory on member states. 2. Amendments which would empower the WHO Director General single-handedly to declare a public health emergency of international concern, a PHEIC, given this unelected, unaccountable individual, unprecedented levels of power to dictate UK public health policy and to restrict fundamental freedoms.
Will he give way?
I will.
I'm very grateful. Isn't it even more extraordinary that that power would be given to that person, given I understand that the UK voted against him becoming the Director General of the World Health Organization in the first place, and he was actually China's man for the job. Does that not make it even more extraordinary that the UK would want him to have those powers?
It does, although some people who have been favoured by China have been doing very well lately. But I take my right honourable friend's point. Thirdly, there would be amendments to implement an international global health certification system, enabling nations to enforce travel restrictions using tools such as vaccine certificates, passenger locator forms and traveller health declarations, all tied potentially to a personal QR code. And fourthly, amendments seeking to increase censorship of dissenting voices by mandating systematic global collaboration to counter dissent to official governmental or WHO guidance. Taken together, the proposed amendments could empower the WHO to issue requirements for the UK to mandate highly restrictive measures such as lockdowns, masks, quarantines, travel restrictions, medication on individuals, including vaccination, once a PHEIC has been declared by the WHO itself. This is something we should all be very concerned about. We as parliamentarians are meant to be guardians of the country's liberty, and therefore we need to be very anxious about this. Damien, as you will know, I've been known to raise concerns about loss of our sovereignty in Parliament before. Clause 38 of the Withdrawal Act 2020 states that the will of Parliament is sovereign, and so it should remain. So my key question to the Minister, and I would be grateful, I've known him for years, he's a decent man, if he would take the trouble to answer this very specifically in his wind-up, otherwise I'll intervene on him. My key question is this: could these amendments even potentially allow the World Health Organization to put this country into lockdown without our approval? Yes or no? Thank you, Dame Maria.
Thank you very much indeed, Dame Maria, and I'm very pleased to be able to speak in this debate. And my thanks to all the petitioners who've signed it, all the public who are interested in this, and to the Honourable Member for Lancaster and Fleetwood for her introduction. It is somewhat concerning how few of us are present at the debate. I'm very proud always to act in concert with a band of brothers here. We happy few who seem to fight on all multiple fronts at the moment. But the fact is, this is a fringe issue in Parliament, and as demonstrated by the empty benches, and yet the public, significant numbers of the public, do have a real interest in this topic. So what is going on? And I think the explanations are partly that it's a complex matter. It requires significant delving in pretty abstruse documentation and websites, and this debate goes on. It's not always that thrilling. It's also that we're debating issues of principle, which often fail to get traction in the media, the abstractions of sovereignty and individual rights, while occasionally generating headlines don't generate proper attention in Parliament or in the media. But I think the fundamental reason why this topic and these proposed regulations and the proposed treaty from the World Health Organization have not generated the sort of disquiet that we few members feel among our colleagues and among the wider public and the media is that we want, as individuals and as citizens, to trust in the government when it comes to healthcare. We really, really do. It's why we have such a commitment to the NHS in our country. We want the state to be trusted and authoritative and capable when it comes to our health. And we instinctively recoil at suggestions that there's a problem when it comes to management of healthcare. And yet, as Dame Maria, as we've heard today from my colleagues, put the details very well, and I won't reiterate the points that have been made. There is clearly a difficulty and a challenge and a problem with the proposed regulations and the proposed treaty. It is suggested by the World Health Organization and by the governments that are contributing to this, to the design of these regulations and this treaty, that the World Health Organization moves from being an organization which is responsible for identifying on behalf of the countries of the world, identifying pandemics, moving towards actually coordinating and taking responsibility for coordinating the response to those to pandemics. That is an enormously significant change from identifying to coordinating the response of nation states in how they manage their own healthcare. And we've heard expressed very well the threats that that represents in terms of enforced mandates, enforced lockdowns and so on. And I would echo the call on the Minister to address that specific question about whether the World Health Organization will be able to impose a lockdown or any other intervention without the consent of Parliament. I also would like him to reflect on the proposed, the clause in the proposed regulations that suggests that the World Health Organization would require countries to tackle misinformation and disinformation. And, Dame Maria, we must remember the World Health Organization, which is aspiring to this power, is the organisation which in January 2020 denied that there was human-to-human transmission of COVID-19. It also, for some months, even longer, for many months, denied the possibility of a human origin of the COVID-19 vaccine, pandemic, the virus, as having originated in the Wuhan facility. So this is the organisation which we are proposing to give the power to intervene in international debates and close down discussion under the guise of misinformation and disinformation about both the origins and the appropriate responses to pandemics. And if we should have concern about, as we should, about the value of the World Health Organization in future based on its record, I'm afraid we have to have the same scepticism about our own government's role, because the trust in healthcare that we all desperately want to have, I'm afraid has been badly tested through the experience of recent years. And I echo many of the points, particularly by my right honourable friend, the member for Rayleigh and Wickford, thank you, just now about the sort of radicalisation that I think we both experienced through the cause of the COVID experience, from having started from a position of trust in government, trust in the state, to profound scepticism. And I just want to, if I may, Dame Maria, call attention to this new book which has come out, which I've contributed the afterword to. I don't think I derive any benefit.
We do advertising in here.
Oh, okay. Forgive me if I don't. I'm not going to advertise, and I derive no benefit from it, I should emphasise. But I have contributed to the book, and it's written by the campaigners Us For Them, who did such good work to call attention to the effect of the lockdowns on children, and again became radicalised through the experience. And they've written a very good book about the effect of the lack of accountability in the COVID response. So while I don't share some of their concerns about particular decisions made by particular officials or ministers, but I do share absolutely their concern about the failures of accountability of the system as a whole. And while the inquiry that we're all watching that's going on at the moment into the COVID, into the whole episode, is performing a fairly useful function, I think, in identifying sort of misdemeanours and confusions, and in a sort of rather, whodunit way, identifying which ministers and officials and advisers deserve individual blame. I think what we're really getting out of that inquiry is the evidence that the system as a whole failed. There's no point really, in my view, in identifying the culpability of individuals when the fundamental problem that inquiry, in fact all of our experience demonstrates, is that the state, the British state, failed. And to the topic of today's discussion and these proposed regulations, and I made this point in the last debate we had in this place in April, the problem in the whole COVID episode wasn't the lack of international cooperation. There was a very high degree of international cooperation, a remarkable degree of international cooperation. Almost every country did exactly the same thing, following China's example. What we didn't have enough of was independent decision-making at the nation-state level. And the bits that worked at the nation-state level was when on the ground individuals and communities and local government and local public services and local businesses took initiative to collaborate, to develop their own responses, to take responsibility locally for supporting communities. And that's what we need to see, I believe, at the national level too, more independent decision-making, while obviously collaborating and sharing information about what works. So, Dame Maria, to conclude, I'm glad to hear, and I recognise the point made by the Honourable Member for Fleetwood and Lancaster at the beginning, and I'm sure the point will be echoed, I hope it will, by the Minister, that the government is committed to ensuring that British sovereignty is reflected, national sovereignty is reflected in the wording of any new treaty. But I'm afraid, and we're familiar with it from current debates, that the peppering of the language of sovereignty into legislation is not sufficient. What we really need is the practice of sovereignty and the declaration of principles. Principles are only valid insofar as they are put into practice. And we want to see actual practice of the principle of sovereignty in the treaty that emerges and in any amendments to the regulations. So I'll conclude with these 4 questions for the Minister. I hope he'll be able to answer them. Firstly, when will we see the next iteration of the draft regulations? I'd understood that they were expected by now. When will we see them? Secondly, which minister, whether it's him or a colleague, is actually responsible for negotiating the treaty and the regulations? And I'm also interested to know which civil servants are involved. We knew who the civil servants negotiating Brexit were. I wonder who has been delegated to the WHO and is working on our behalf there. Thirdly, the question has been raised by colleagues about the potential imposition of a very significant bill for the taxpayer in response to WHO mandates. Has work been done to quantify the potential cost to the taxpayers of implementing the requirements of the treaty? And finally, will the government commit, and I appreciate he's not in a position probably to do this today, but will the government commit to publishing its red lines, what it will accept and not accept? And I don't think just vague commitments to preserving sovereignty is sufficient. What exactly will be acceptable and not? And I appreciate the negotiations are going on in collaboration with other states, but I think it is appropriate for our government at this quite advanced stage of the negotiations to declare publicly what it is and what it's not prepared to cede in the way of our independence. Thank you.
Christopher Chope.
Dame Maria, it's a pleasure to serve under your chairmanship, and can I also thank the Honourable Member for Lancaster and Fleetwood for setting out the issue quite briefly, succinctly, but can I also thank her in her capacity as the chair of the Petitions Committee for having allowed us to have a 3-hour debate. Because one of the consequences of that is that once all the backbench contributions have been heard, then we'll be able to hear in extenso from Her Majesty's official opposition as to how they are going to deal with this issue. And even more important, we'll be able to hear from the Minister, who I'm delighted to see in his place, exactly what the government is doing in response to each of the issues which has been raised in this debate and which are of such crucial importance to so many of our constituents. I think one of the reasons we're here where we are now today is because the response to the debate which we had on the petition in April was frankly totally inadequate, Dame Maria. It was full of just generalisations and vague suggestions that somehow it was all going to be all right in a day, and really it was, why are you coming along bothering the government with this trivial material? And yet, actually, this issue goes to the heart of what this House is all about. It's about who's in charge. Are we, as a democratic parliament, in charge of the laws of our country? And any attempt by the government to give away control over those laws to an unaccountable international organisation. And it's because of that concern that so many people have signed this petition and that we are having this debate again today. And if my friend, the Minister, doesn't actually address these issues today, then people will say, well, the government is not taking it this seriously. And that would be a disaster, because once we've given away these powers to the WHO, which is power-hungry, and what international organisation isn't power-hungry, but the WHO is certainly one of those power-hungry organisations. Once we've given away our powers to them, then it's very difficult to get them back again. And we know the ongoing discussions about where we stand in relation to international treaties and international law, and the quite insidious development, I think following the recent Supreme Court case of what's called customary international law, which is a sort of a development which basically means that a group of outsiders can tell us in this country what's good for us and what's not good for us.
Well, my honourable friend,
of course I will.
Just briefly, I think for the avoidance of doubt, would he agree with me that none of us have argued this afternoon for withdrawal from the World Health Organization? You might call it Wexit, for want of a better phrase. Yeah. But equally, yet, says my other honourable friend, but what we do want to be assured of is that they cannot overrule this sovereign parliament. That's a fundamental difference, isn't it?
Absolutely, I agree with my right honourable friend. We don't want to withdraw. There's no need to withdraw from a voluntary organisation, which is confined to giving us advice, providing data and information, and who would resent having access to data and information? Indeed, I think that the whole essence of a responsible society and the relationship between that society and the government is that the government should provide the information to enable individuals to decide for themselves whether they want to take particular medicines, whether they want to go on trips to particular countries, or whether they want to be vaccinated in a particular way, or whatever. And I see the proper role of the WHO as providing that information source to governments across the globe, and those governments can then decide for themselves what they like and what they don't like. And they will have regard to the fact that the WHO, not only has it got a chairman who seems to have been imposed by the People's Republic of China and was strongly opposed by our own government, but it seems very much that the whole WHO organisation is too beholden to China. It's also too beholden to some of the big donors to the WHO, because if one analyses how the WHO is funded, one sees that organisations like the Bill Gates Foundation are significant supporters, and so he who pays the piper calls the tune. I think that's a good starting point in looking at these things, and I think there's too much evidence, Dame Maria, that the people who are paying the piper in the case of the WHO are calling the tune to too great an extent. So if we take the view that once bitten, twice shy, then let's remind ourselves of what happened during the pandemic. As others have already mentioned, the WHO went into that pandemic with a policy saying lockdowns are not the answer, cannot be the right answer to a pandemic for all sorts of reasons, and we can now see the adverse consequences which have flowed from our decision in this country to have a lockdown and compare it with, for example, what happened in Sweden. But that was the advice of the WHO. And then during the course of the early part of the pandemic discussions, without any evidence being brought forward, the WHO suddenly changed its advice. And why did it do that? There's a suspicion that the reason it changed its advice was because of undue influence from the pressures that I've already been describing. But we'll never know why it changed its advice. But all we do know is that somebody who changes their advice like that without any evidence is somebody who shouldn't be in charge of telling us what to do. We should be in a position where we can say, well, if you want to change your advice, fine, but why do you change it? We don't have to follow it. But under these proposed treaty amendments, we would have to follow it. And that's obviously a great concern, because people can see what's happened in the past, and that's potentially a guide to the future. And I think even more sinister than that in relation to the changing the advice in relation to lockdowns was the approach of the WHO to finding a treatment for COVID-19 patients, because there was a lot of evidence to suggest that ivermectin, and that was not the only drug, but ivermectin was a drug which could be used with a really good effect to improve the outcome for patients who were suffering from COVID-19. And the WHO intervened to prevent the strong evidence suggesting that the treatment with ivermectin might improve your chances of survival by as much as 81%. As the WHO intervened at the behest of certain pharmaceutical companies which were in competition with the producers of ivermectin, it intervened in order to give very dubious advice to the effect that ivermectin should only be used in clinical trials. And for those who are not familiar with too much of the detail of this, I commend a book by Dr. Pierre Corey, who is a distinguished physician in his own right, and an epidemiologist. I think, is he an epidemiologist? He certainly deals with pulmonary and critical care medicine, and he's a specialist in that. And he has been in charge of the Frontline COVID-19 Critical Care Alliance. And he's produced a book called The War on Ivermectin. In other words, this was a war organized by the WHO against a remedy for COVID-19. And the reason for that was because obviously the whole of the vaccine development program was prefaced upon the fact that there was no cure for COVID-19 and no effective treatment for it. And because of the absence of such treatment, it was then legitimate for experimental vaccines to be brought into play without the full licensing process. And because there was nothing else, we were in a desperate situation, there was no other way out. But actually, there was a lot of evidence to suggest that ivermectin... Sorry.
There, but perhaps let's leave Amazon to sell books, perhaps.
So I was just holding the book, as I was about to quote from it, Dame Maria. I wasn't trying to advertise it. I haven't contributed to it, although I have to admit that this book was given to me and I didn't pay for it. Okay, but I will get to the. So I can put the book down, and people don't have to look at it me waving it around anymore. I will get to the quote. That I wish to say. Dr. Corey says, the correct anti-recommendation that followed, and this is the recommendation from the WHO against ivermectin, read like this: we recommend not to use ivermectin in patients with COVID-19 except in the context of a clinical trial. This recommendation applies to patients with any disease severity and any duration of symptoms. A recommendation to only use a drug in the setting of a clinical trial is appropriate when there is very low certainty evidence and future research has a large potential for reducing uncertainty about the effects of the intervention and for doing so at reasonable cost. That was said in the knowledge that there had been an 81% reduced risk of dying as a result of work that had already been done. And indeed, in India, the reason that they were very successful in having reduced numbers of deaths immediately after the pandemic started was because they were using ivermectin in extenso. And so the refusal of the WHO to endorse a a remedy or treatment, in the eyes of Dr. Corey, has contributed to the loss of millions of lives across the world. That's a quote from his book, which I will now put down. But Dame Maria, when I first read about this aspect of the work of the WHO and the way in which it had been corruptly influenced by drug companies that had a direct financial interest in discrediting ivermectin, it raised alarm bells. And I thought, well, hang on a minute, why is the WHO engaged in this sort of activity? And I hope that the government will start looking really seriously and sceptically at the work of the WHO and the extent to which it is unduly influenced by external factors and is not based upon straight science, but is actually, a lot of it is political. And I think reference has already been made to the fact that the WHO doesn't seem to be too interested in trying to get to the bottom of how COVID-19 began in the first place. Did it begin in a laboratory in China? Of course, that narrative wouldn't fit in with the WHO being under the control, effectively, of the Chinese government. So,
will he give way?
Of course I will.
I'm very grateful. And this comes back, of course, to the point made by our honourable friend for devisers so effectively, that the WHO said prematurely, quote, it was extremely unlikely that COVID started from a lab leak before, about over a year later, I think it was, the Director General saying there had been a premature push to rule out the lab leak theory. Doesn't that confirm my honourable friend's point that there are clearly external factors at play when they give their advice, and it should be treated with caution, not treated as gospel?
Absolutely, and I'm grateful to my honourable friend for bringing that to our attention. And let us reflect a minute on what other countries are doing. I would have thought that we are one of the proudest sovereign countries determined to ensure that our own parliament retains control over these sorts of issues. But at the moment, we seem to be rather being sidelined by Slovakia, Estonia, and New Zealand. If those countries have already come out publicly to express their scepticism about this process, why has our government been sitting on its hands and just not saying anything? Instead of being mum about this, I hope that our government will now say that let's, by all means, keep the WHO as a body which provides advice, but under no circumstances are we going to sign up to anything which is going to give them control over our lives. It was bad enough that effectively in this country we had a requirement that people should take vaccines. There was a vaccine mandate. And I was speaking the other day to a constituent of mine who worked for inspecting care homes, and he was told that he would lose his job because he refused to be vaccinated. He refused to be vaccinated and he lost his job, but I'm pleased to say that he won his case in the tribunal, Dame Maria. But that was the sort of the consequences for people who were falling foul of these vaccine mandates. And the prospect that it wouldn't be a government, our own government, that would be telling people what they had to take in terms of vaccines, but it would actually be some unaccountable foreign international organisation, makes it even more disturbing. And so these are really important issues, and I hope that my friends in the government will take them a lot more seriously than they seem to have been taking them up to now. It's still not clear whether it's the Department of Health or the Foreign Office which is in charge of this. It's not, and as has been said, we need to know who amongst the ministers is actually going to be getting down to the detail and arguing the toss and ensuring that The WHO continues as an organisation, but certainly does not take control of our lives. So, Sir George, I'm pleased to see you in the chair. If I sit down now, then it means we'll have just shy of 2 hours to hear from the front benches. And it's significant that there doesn't seem to be any SNP spokesman here, but it's just short of 2 hours to hear from the colleagues of the front benches as to exactly what action they're going to take to address the concerns of more than 100,000 petitioners on this subject and a whole lot of other people besides.
Preet Gill.
Thank you, and it's a pleasure to serve under your chairship, Sir George, on this debate responding to the E-petition 635904 relating to the International Health Regulations 2005. And it's wonderful to see so many of the public here in attendance today. I want to thank my honourable friend, the member for Lancaster and Fleetwood, who is chair of the Petitions Committee, for her contributions today and opening today's debate, and the honourable members for Shipley, for North West Leicestershire, Wokingham, Rayleigh and Wickford, Devizes and Christchurch for their contributions this afternoon. I was, of course, in the debate responding to a similar petition regarding the draft treaty on pandemic prevention, preparedness and response in April earlier this year. I hope the members who were also in that debate will forgive me for retreading some similar ground. The COVID pandemic was one of the most surreal and seismic events of our lifetimes. Hundreds of thousands of people have died here in the United Kingdom. Millions more have been extremely ill, and there are still perhaps 2 million people who are living restricted lives, now in their 4th year of shielding, because they are clinically vulnerable to the virus. We should not forget them. As our economy and public services still recover, it is vital that we learn lessons and take steps to strengthen our resilience for the future. And I hope that the inquiry taking place at the moment will be a valuable resource in this respect. Our NHS was badly prepared. The government's handling of public health measures was chaotic, and we jumped in and out of lockdowns. And some measures from the guidance issued to care homes, to Eat Out, to Help Out, were a concern raised by members of this House, including myself. And as we discuss the petition today, we must recognise the international dimension to the pandemic too. Deadly infectious diseases do not respect borders. It is therefore squarely in our interests to cooperate with other nations and support efforts to coordinate the global public health response. The lesson of the pandemic was that no one is safe until everyone is safe. So it is clear that global cooperation on pandemics and biological threats need to be strengthened. The opposition, therefore, absolutely support the principle of legally binding international health regulations which define the obligations of countries in handling pandemic-level threats. This is critical to our national health security. The international health regulations under discussion have, of course, existed in various forms since the 1960s. The latest iteration came into force in 2007. As they stand, the international health regulations obligate the 196 state parties to develop national core public health capacities for detection, assessment, control and reporting of public health events and at some international ports, airports and ground crossings. It requires parties to notify the WHO of serious diseases with risk of international spread. And it sets some of the human rights and other protections for any of us travelling abroad, for example, the protection of personal health data. These requirements are hardly controversial, apart from they were not on their own sufficient to prevent COVID-19 spread around the world. That is why we think they must be strengthened. Climate change and globalisation mean biological threats are only becoming more common, and future pandemics could be deadlier than COVID-19. And if another epidemic strikes with that same infectious potential, we must make sure that we are better prepared. So, George, the subject of debate today is how amendments to the international health regulations and the pandemic accord under negotiation at the World Health Organization might actually impact United Kingdom public health policy in the future. Earlier, I mentioned some of the measures taken by the UK government during the pandemic, ranging from interventions like Eat Out to Help Out to the 3 national lockdowns. I think that the variety of these policies and how they compare with some of the other 195 countries who are also signed up to the international health regulations shows that the UK and other countries were able to exercise considerable discretion in their domestic response to the pandemic. And I think it's really important to emphasise and begin by emphasising this fact. The E-petition we are discussing asks for Parliament to vote on amendments to the IHR, which are currently being negotiated alongside the draft text of the Pandemic Accord that we debated here in April. And it raises concern that Parliament has not voted on an amendment that the UK government agreed to and was adopted at the World Health Assembly last year. This is a process-related amendment under Article 59 of the International Health Regulations, which reduces the time for future amendments to come into force, as mentioned earlier, to 12 months. And of course, until any such future amendments are agreed, it will actually have no impact on the United Kingdom. In any case, the principles that protect our national sovereignty will remain. The democratically elected government is responsible for negotiating, for signing, for ratifying, amending and withdrawing from international treaties under its prerogative powers. Any legislation, if necessary, to implement the regulations would actually have to go through the proper parliamentary process. No international treaty can, by itself, change United Kingdom law. As for the future amendments, it makes sense that as the only international treaty on infectious diseases, changes to the IHR are considered alongside the draft text for the Pandemic Accord. Of course, as negotiations are still underway, nothing is agreed until everything is agreed. However, I will.
If what she's just said is true, why has Parliament just spent 2 weeks arguing about Rwanda? And can I ask her a direct question? She has heard many concerns expressed from these Conservative benches about these proposed amendments. With the exception of the late member for Fleetwood who introduced the debate, not one single Labour backbencher has even been present, let alone contributed. So here's the question. Would a future Labour government be minded to accept the spirit of those amendments to the WHO treaty or oppose them? Our position is very clear. What's hers?
Well, I think I've been making my position.
I understand that feelings are running high and people have areas they want to explore, but any further interventions, I hope they are brief. Thank you.
Thank you. I think we all know that Rwanda is just a gimmick by this government, and I think I've already set my position very clear, and I continue to make my remarks so that the government is absolutely clear as to where we stand on this position. I am pleased that the Zero Draft highlighted that states must retain sovereignty and that the implementation of the regulation shall be with the full respect for the dignity, human rights and fundamental freedoms of persons. I'd ask the Minister to take the opportunity to update us on the progress being made in negotiations over the amendments and the draft text, and can he reassure our constituents that they would not sign up to anything that would compromise the UK's ability to take domestic decisions on national public health measures? I will do.
I don't understand the Honourable Lady's argument. This amendment to the regulation would mean that the WHO could decide there was a health crisis in our country, whether we thought there was or wasn't, and could then tell us how we had to handle it in far more detail than the advisory work it did during the COVID crisis. It would be mandatory. What doesn't she understand about that, and why doesn't she disagree with it?
Order. Those in the gallery, I know there are strong feelings, and I know that they've come here with a great deal of interest in the subject, but I do think they need to be quiet. It's not an occasion for applause or shouting out. So I'd be grateful if people could respect that. Thank you.
Thank you. Thank you. I think I made my position really clear, hence my question to the Minister is that, our constituents want reassurance that they wouldn't sign up to anything that would actually compromise our ability to take domestic decisions on national public health measures. Nothing has been agreed. I mean, today is an opportunity to hear from the Minister as to how those negotiations are actually going forward and what amendments have been accepted. So I also want to hear from the Minister. The reality is, I'm not taking any more interventions, the reality is that while the pandemic is over now, the threat is not over. And we must never leave our country with such a soft underbelly again. We strongly support efforts to strengthen the international legal framework to prevent, protect against, control and respond to cross-border health threats. It is squarely in our interest and integral to our security to encourage other countries to commit to do the same. Thank you.
Andrew Stevenson, Minister.
Sir George, thank you. It's a pleasure to see you in the chair, and I'm grateful to the British public and the honourable member for Lancaster and Fleetwood for raising the important issues covered in the E-petition we are considering today. Can I start by thanking my honourable friends and right honourable friends, the members for Shipley, North West Leicestershire, Wokingham, Rail and Wickford, Devizes and Christchurch for their contributions, and can I thank the Shadow Minister, the member for Birmingham Edgbaston, for her remarks. I'm only surprised to not see our honourable friend, the member for Strangford, here today, although I'm sure he would be here if he was able to. Sir George, we've held a similar debate on this matter already. However, today is slightly different from the debate that we had in April. The matter before us today is whether the House should vote on amendments to the international health regulations. And I think the discussions that this has stirred, in this place and outside, is because this matter relates to two vital aspects of our governance: our sovereignty and our national interest. And in both, Sir George, I am pleased to offer assurances to colleagues and to the public that I am satisfied our approach to these negotiations safeguard our national interest without compromising our sovereignty. I will seek to set out in my speech why I believe that before turning to the specific questions my honourable and right honourable friends have put during the debate. So why are these negotiations in our national interest? Because the international health regulations don't just exist to protect others from health threats, they directly benefit the UK and help keep our people safe. The last decade has shown diseases such as COVID, Mpox and Ebola do not respect borders. In the case of other health threats, like the recent case of botulism in France, the IHR allowed us to swiftly engage with French officials to identify and follow up with exposed UK citizens. And when Vladimir Putin committed an act of terror on our own soil, the IHR helped to slow and stop the spread in Salisbury. The IHR provide international standards for what it means in practice for each WHO member state to prepare for, detect, prevent and respond to public health events.
I thank the Minister for the speech he's making, and the point he's actually making is that the IHR is currently working perfectly adequately, in which case, why do we need to amend it?
So I think the IHR is working well, but as was actually given by a number of my honourable and right honourable friends during the debate, there is lots of criticism of how IHR worked, and of course he will remember our right honourable friend, now no longer in this place, Boris Johnson, the former Prime Minister, was one of the leading voices in saying we should update the IHR because we surely need to learn lessons and move forward. So I believe there is mutual interest for us, interest for other countries, in working together. For example, delivering a sensitive surveillance system, providing an early warning of potential threats to inform decisions that national governments will make during public health events and emergencies.
As the House has already heard, we may have to vote on these amendments, along with others, by the end of May of 2024. It is possible that by then we will already have had a general election. The House has heard very plainly from the Honourable Lady that the Labour Party would be minded to support all of these amendments, and when we challenged her, she stopped taking interventions. So Labour are going to back these amendments if they were in government. What would the Conservative Party do?
Well, I thank my right honourable friend for that point. I genuinely believe there is a lot here in all of our interests, and I don't want to turn this into a kind of party political ding-dong. Of course, I genuinely believe having us in government leading these negotiations and then getting these negotiations settled before any general election is firmly in the UK's national interest, because I believe that we will deliver a treaty which is in the interests of all our citizens and respects national sovereignty. But I also believe that, I would very much hope an incoming Labour government would very much do the same. But certainly, it is one of the reasons why I believe we need to make rapid international progress to agree any revisions to the IHR, because I believe we are in a good place to do that now, and we should also move swiftly rather than kicking this into the long grass. I think the last pandemic taught us that actually trying to make things up as we go along was not the best course of action. Laying some good foundations and providing some better certainty in how things are going to be dealt with, I think, is the best way forward.
But surely these regulations and the changes are not just one block which we either accept or reject. The government can deal with each proposed amended change seriatim and one by one. And that's why I hope that my honourable friend is going to spell out today, in response to the points that have been made, exactly which of these amendments he supports and which ones he doesn't.
Well, my honourable friend tempts me, but I think, as he saw during the Brexit negotiations, the government did not provide a running commentary on negotiations. We do not provide a running commentary on our trade negotiations. We do not believe that that is in the national interest to do. Indeed, the latest draft of the Accord, obviously published in October and is available on the WHO website, it is very clear that no text of that Accord has been agreed yet. The whole text is still under negotiation. The draft is just a basis for negotiations and will evolve. There are areas of the new draft which we would clearly reject. There are areas of the new draft which we would like to make even stronger. So this is an active negotiation between 193 member states to come up with revisions to the IHR, which we all believe, by mutual consensus, would be in our global interest.
Question posed by my honourable friend, the member for Devizes. Who is actually negotiating on this country's behalf, and which minister has ultimate responsibility?
So the negotiations are being led by civil servants, across Whitehall civil servants. I am not going... I do not believe it is right to name those civil servants. I have overall lead in the Department of Health. For this, I'm working closely, and I've already met with Minister Mitchell in the FCDO. But there are many other government departments who will have a very clear interest in this. The Minister for Life Sciences, for example, will be very interested in this. And any treaty agreed will, of course, be subject to cross-government right round in the usual fashion to agree a UK-wide position. So it is fair to say there is not just going to be one pair of eyes from the ministerial ranks looking at this. There are going to be multiple lots of eyes looking at this from across government to ensure that when we get to a deal, it is a deal that can be agreed across government and something that we believe is in the UK national interest.
Very grateful to the Minister. The possibility that the language may shift from saying may to saying shall is fundamental. Yeah. All that he said about their current collaboration I welcome. I'm glad it's working so well, but that is based on advice and urging rather than requirement. Seems to me it's just like the British people voting for the common market with the assurance that we had a veto on any law we didn't like, and then somebody came along and took the vetoes away without seeking the British people's permission, and the relationship went wrong from there on. This could do exactly the same to the WHO if we take away the veto.
Yeah. So, I hear where my right honourable friend comes from, and I share his concern. But as I hope he would recognise, the WHO is led by its 193 member states who are currently negotiating this, and all international health regulations to date have been agreed by consensus. And we would hope that any changes to the regulations are agreed by consensus. There are things, as I say, there are many amendments, there are many parts of the draft which we would not agree to in its current form. So, I believe these negotiations will get us hopefully into a position, because I believe it's in all of our interests, and it's in our national interest, to agree revisions to the IHR. But that has to be done through negotiation, that has to be done through consensus. I think having a deadline approaching focused minds, and I think it's the right thing to do. To give another concrete example of why I believe this is important, during the pandemic, the genomic data shared by our friends in India and elsewhere helped us to tailor vaccines as new variants emerged around the globe. And we all saw over the pandemic that, as the Shadow Minister said, no one is safe until everyone is safe, and that global problems require global solutions. The best way to protect the UK from the next pandemic is by making sure all WHO members can contain and respond effectively to public health events through compliance with strengthened IHR. Targeted amendments to the IHR will further strengthen our global health security by helping governments plan together, detect pathogens swiftly and share data where that's helpful and necessary. The pandemic highlighted weaknesses in the implementation of the IHR for global health emergency response. For example, COVID demonstrated that the IHR could be strengthened with a more effective early warning system with a rapid risk assessment trigger for appropriate responses to public health threats.
I'm very grateful to my right honourable friend. Does he not fear the type of thing that happens in these negotiations at the World Health Organization will be very similar to what happens at things like COP26 and COP27 and COP28, where all these countries sign up and agree to something, most of them knowing full well they've got absolutely no intention at all of following what they've signed up to, and we're left following all of these things when other countries don't even bother.
Well, I hope no government would sign up to any treaty that it's not going to follow. I would agree that there have been instances in a whole range of areas where countries around the world have not fulfilled their parts of international obligations. But the UK government, we are certainly not going to sign up to something that we do not believe is fair, proportionate in our national interest, and would not seek to follow ourselves. But I would share his concern that other countries haven't followed regulations in the past, and there's no point us passing strengthened regulations if we do not believe other countries will follow them. But we believe these regulations are designed to prevent the control and international spread of disease. They are limited to public health risks and designed to avoid unnecessary interference with international traffic and trade. That is why we're supporting the process of agreeing targeted amendments to the IHR as an important way to better prepare for future global health emergencies.
I'm very grateful. Can he explain the process in relation to these amendments? Because he's talking about consensus. But what happens if this country does not get its way in relation to some of these amendments, which it opposes? Does it mean that if those amendments are incorporated in the final text, we will be able to opt out of them and will opt out of them?
Yes, that's exactly what consensus means. And can I just be clear, the WHO Secretariat is supporting both processes by hosting the international negotiating body and the working group on amendments to the regulations, and supporting the chairs to prepare texts and answer questions from member states. Both negotiations, though, are member state-led processes. It's member states who are negotiating. It is not the World Health Organization. So, I completely appreciate that some see this as a WHO power grab, but it's important to remember that this is a member state-led process. We came together. I'll just make some progress and then I'll come back to the honourable gentleman, if you may. We came together with other nations through the World Health Organization to agree a process to negotiate targeted amendments to the IHR at the 75th World Health Assembly back in May 2022. By consensus, we adopted a process-related amendments under Article 59 of the regulations. The UK supported these amendments because they increase the timeliness for member states to comply with future amendments to the IHR, which will better protect us from future global health emergencies. And as part of the agreed process, member states could submit proposed amendments for consideration. And to this end, a working group made up of all WHO member states was created, through which the amendments will be negotiated and agreed.
Thank you, Minister, for giving way. He's been very generous for this time. And I think the crucial question that the Chamber and the public would like to know at this stage from the Minister, and he's speaking on behalf of the government who are negotiating these instruments. Does the Minister believe that the WHO guidance recommendations as they were becoming mandatory under amendments to Article 1 and new Article 13A of the treaty, does he believe that they're compatible with retaining UK sovereignty.
So I think this was covered in the previous debate. It's been covered by various ministers, but I think we have been very clear from the outset of the process that we will not agree to any amendments that cede UK sovereignty. If the UK government accepts an IHR amendment that we have negotiated with our international partners, then depending on the context of that amendment, changes to international law may be required. In those instances, the government would prepare any draft legislation before Parliament to be voted on by MPs in the usual way. It's important to remember that IHR amendments and the new pandemic accord, in and of themselves, do not change the power of UK law. If required, we would ourselves be changing UK law through our sovereign parliament to reflect our international obligations under the IHR amendments. So, Sir George, let me be clear. In all circumstances, the sovereignty of the UK Parliament would remain unchanged and we would remain in control of any future domestic decisions for national public health measures.
So just to be clear, to follow from my earlier question, the Minister has put on the... By the way, we thank him for giving way so often. He's put on the record that we have a right to opt out of any amendments with which the UK does not agree. That is reassuring. On that basis, if an amendment were to be voted on by the WHO that said they could impose a lockdown on the United Kingdom without our approval, can the Minister give a commitment now that we would opt out of it?
I can give a categoric reassurance to my honourable friend, my right honourable friend, that is a red line for the UK government. We would never allow the World Health Organization to impose a lockdown in the UK. That is a very clear red line for us. I can't think of any minister who would agree to such a request. I can confidently say, hopefully confidently say amongst my colleagues, as someone who campaigned for Brexit myself and has helped try to deliver Brexit in this place, that I am passionate about this country's sovereignty. And I believe the government's position needs to be crystal clear, and it's one that I endorse. Whilst we support the member state-led process of agreeing targeted amendments to the IHR and the new pandemic accord for the sake of global health preparedness, we will not agree in any circumstances to provisions that would cede sovereignty to the WHO. That includes the ability to make decisions on national public health measures, whether that be lockdowns, which we just mentioned, or vaccine programmes.
I'm very grateful. He will understand people's nervousness about this, because as my right honourable friend for Wokingham said, Ted Heath said in the 1971 White Paper, there is no question of Britain losing essential sovereignty by joining the common market. And we saw how that went. But the point is, what I'm worried about is, will the government have to bring forward proposals that the WHO are insisting upon, even if it doesn't like it, and bring the power of the government voting to that decision? That's what I worry about, is that the government will be... Parliament will still decide, but the government will be forced to bring forward measures in Parliament, even though it might not necessarily agree with them.
I thank my honourable friend for that intervention. This is, I want to reiterate again, a member state-led process, 193 member states negotiating. It will be a difficult negotiation, but all previous regulations have been agreed by consensus. If the text ends up in a position where the UK government does not feel we can sign up to it, the other member states may decide to proceed, but they will not be regulations that we are bound by because we will not agree to them. So this is an evolving situation. We have agreed a pathway for this to be negotiated. As honourable and right honourable members know, the text is available online. The amendments are available online. Can I just turn to some of the interventions made? And can I start by, on the interventions, paying tribute to my right honourable friend, the member for Rail and Wickford, in paying tribute to his wife and other NHS staff. They did an incredible job during the pandemic, and we often, sometimes when debating technical issues like this can overlook their incredible contribution, but I think it's very right what he said today, and also he talked about the importance of data sharing globally, which I think we would all agree is vitally important. The Honourable Member for Devizes asked when the next iteration of the text would be available. So no new texts or amendments have been agreed yet, so there is nothing further to be shared. However, obviously we expect negotiations to continue until May 2024, until Member States agree completion at the World Health Assembly. I am actively exploring ways that I can keep the House informed with further developments, whilst, as I say, the standing position of the government on these issues is we don't do a running commentary on negotiations, but I'm actively looking at what more we can do to keep members informed. That leads me on to another question he asked about the costs of the bill. Obviously, as we haven't agreed kind of provisions of the treaty, we can't yet estimate how much this may cost and whether we would publish our red lines. Unfortunately, as I say, I'm going to decline on that. I've said one red line, clear red line today, and we have a very clear red line on sovereignty, but I don't believe we should run through these negotiations in public. I believe we should give our negotiators time to reach as much international consensus as possible.
Minister has been extremely generous in giving way, and could one of the lessons from the Brexit negotiations was that civil servants in the room negotiating weren't always following the ministerial line. So can I encourage my right honourable friend to go himself to the negotiations, repeat what he's told the House today, and make sure that the civil servants who are in the room when he leaves get the message that he's just delivered today?
I will certainly bear what my honourable friend has said in mind. I would say that the civil servants who are involved in this negotiation, some of the civil servants who are involved in this negotiation, have already heard very clearly from myself. They've heard from Minister Mitchell, they've heard from Minister Griffiths, the Life Sciences Minister, on various red lines and various things that we are very, very clear about. So there is clear ministerial input. There will be a part in this process where ministers can get involved, but I will certainly look into what he suggests and what more I can do to ensure that UK sovereignty is in no way compromised, and I can continue to provide further reassurance to all those honourable and right honourable members who have spoken today. Sir George, we all want, well, maybe not all, but I believe the government want a strong World Health Organization that is fit for purpose, that is able to respond rapidly to global health challenges and future threats. And the UK is working with our international partners to shape it in that way. Our priorities for the amendments and for the Accord are global in scope, but they are in the pursuit of our national interest. It is in our national interest to prevent another pandemic. Should, God forbid, another pandemic occur, it is in the national interest to cooperate with others to slow and stop its spread. In these negotiations, I can assure honourable and right honourable members, I would never countenance acting contrary to our national interest. We will protect our country from future public health emergencies without ceding an inch of sovereignty. Thank you.
The question is that this House has considered E-petition 635904 relating to the International Health Regulations 2005. Many of that opinion say aye. Aye. Of the contrary, no. I think the ayes have it. The ayes have it. Order, order. The sitting stands adjourned.
The proceeding has ended. 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 The proceeding